Mayor Den Plato says these are unprecedented times and has urged the public to cooperate in order to curb the spread of the virus. We'll take a look at that story later. Right now, let's go live to the Department of International Relations in Pretoria, where that inter-ministerial meeting has started. Let's go there live.
The President has put into place. Without any further ado, I'll call upon the Minister of Health to come and speak to us on these matters of the coronavirus, and then thereafter, the economic cluster, the ministers who are in the economic cluster will then speak to us and the nation on how we are going to implement the measures as pronounced by the President. Minister Mkhize.
Thank you very much, colleagues, members of the media. As we start, I just want to refer back to yesterday. The President issued a statement in his in his address to the nation, where he announced a lockdown, and we are here firstly to thank the President for his courageous and decisive leadership, and the National Coronavirus Command Council. We thank them for all the guidance and support in the fight against the coronavirus. We are aware that the virus has actually increased in the whole world. The number has really gone much higher than we actually initially anticipated. So in our case, we have been observing that the numbers of people who are affected worldwide has gone up to 382,000, which is much, much higher than what had alarmed the world when the problem was in China. And that of late, the countries that have gone up in their numbers have basically become Italy at 63,000 with more fatalities than were recorded in China. USA has also gone up to 46,000, Spain at 35,000, Germany at 29,000, and Spain has got 2,300 fatalities, and Iran at 23,000 with 1.8 fatalities, with France at 19,000. Korea, which was the second highest at some point, has actually stayed at about 9,000 with 120 fatalities. And Switzerland and UK are actually nearby those. This basically indicates the fact that the outbreak, as has been referred to as a pandemic, is actually changing, and it must obviously be issues that relate to the response of each nation and various other conditions, probably environmental, social, behavioral, or cultural issues, and various other health-related, factors that must be an issue at this level. So the last time when we spoke, I referred to us going into an area of hard combat, basically saying that all South Africans need to see themselves as part of this battle, as soldiers, and what we need to do at the level at which we are is to help guide everyone to say what role do we see each one of us playing in the fight against this virus. If we were to borrow the military terminology, once the Commander-in-Chief has spoken, all the field commanders must now go out and outline the battle plan. And these are the ones you have here, who are going to be indicating various aspects of the battle plan so that all South Africans have a sense as to what role they're going to be playing, but also what other factors have to be taken into account in this particular battle. Now, the way we're looking at it, there are a number of areas that we need to look at. So, in terms of our strategy we said has to be about flattening the curve. In other words, we allow the infection to be drawn out in such a way that we get as few people infected as possible so that it does not grow so rampantly as to overwhelm our health services. In that way, we have to behave or take certain decisions that will make it easier for us to manage it and more difficult for it to spread. And this means that there are a number of areas that we must focus on. The first of those is the area wherein we have individuals who are tested, who are positive, that must be taken for treatment. And when they get treatment, they get isolated so that we can at least know that not only are they going to get better, but also they're not going to be infecting other people. It's easier to deal with that because our health services, health workers are well trained to deal with that. The second aspect is to those who were in contact with them, we call them direct contacts. Those are the ones that we will actually trace after that and make sure that when we find them, we test them, and those who need to be quarantined will be quarantined so that we can ensure that we know if they're developing the virus within that period, and at the same time we keep them somewhere in a way that they don't need to spread the virus to the next individuals, as it were. The third area is we have noticed that one of the major risky areas is infection that would have come from specifically affected countries. I've mentioned them already, and therefore people who would have been in those countries would inadvertently carry the infection unknowingly, and before they know it, it would have spread to other people. And so this means, therefore, we had to limit the numbers of people who could have come from the areas where they could be infected, and this, therefore, explains what it means to restrict movement at our boundaries, at our borders, mainly in the airports and at sea, therefore seeking out people who could come from areas that could be risky, and therefore we have President has spoken about the limitation of movements of aircrafts and cruises that come from those particular areas. This is a very important area because if we count on the numbers, we have seen that 75% to date of those who are positive actually have got a history of travel to these particular countries. And another percentage of those that are outside that, within that 25%, are people who have got a direct link to those who would have come or who have been traveling to those particular countries. So we believe that limiting that is going to help us to reduce the numbers of people who are infected. Thereafter, we will then be dealing with what we call internal transmission. Internal transmission basically means that you could either have people who are linked to those who were abroad in the particular countries, but they themselves were not abroad. So a family, we've already got families where the father or the mother or both were abroad, they came back, now the children are positive. So that is internal transmission of people who have not themselves had a history of travel. Then linked to that is what WHO refers to as sporadic cases. These are instances where someone is found to be positive, but they cannot point out at anyone that they would say they know for a fact was abroad, which means that the infection is becoming more endemic in the community, and therefore you can pick it up somewhere without it being linked to someone who has come from abroad. So those are the various fronts on which we want to deal with this particular issue. Now, I've outlined how we deal with each one of them, but the last one is actually the basis on which you have a lockdown recommended, because what it basically says is that last week the President had asked that we must reduce large meetings, and so we've been quite grateful for the churches, church leaders and religious leaders for saying they would cancel the religious gatherings, and that was a huge act of patriotism on the side of the religious leaders, who decided that despite the fact that they passionately believe in the services that are conducted in churches, in mosques, and synagogues, but they then said would like people to pray from their homes and turn their homes into synagogues, into mosques, into churches. That actually helps a lot, because there are instances, and I'm going to go into one of those, where those gatherings can actually give huge amounts. I did make a mention in the past of a church in South Korea which was responsible for about 59–60% of the spread of the infection in that country. And therefore, it's important for us to acknowledge the very, very huge contribution that has been made by the religious leaders by just agreeing that they will reduce church services so that there are no more than 100 people, and that they will actually cancel the Good Friday and Easter church gatherings. That takes care of a huge amount, because people would have moved from the whole of SADC, they would have moved from different parts of the country, as it were. That left then for us one huge area of a huge movement of people, and that was the taxis and the trains, where the numbers of people per day, people who travel in South Africa, are 16 million. And that number, that is exclusive of those who travel in their own cars. I'm just talking about public transport, largely taxis, 16 million people every day, and where if the infection were to be spreading, it could easily spread from one person to a large number of people who cannot be traced as contacts because they don't know each other. And by the time the infection is detected, a number of people could have been exposed. So that is the courage that the President's leadership has been able to give to us, that we allow that space for freezing of movement. We're basically trying to freeze the movement of the virus from one person to the other through the congestion. That's what the lockdown is all about. And I'd like us to understand this as an act of really a very strong measure to try and get all of us to cut this virus and cut it down at the beginning of its trade. This issue, therefore, becomes an important contribution to managing this. But I want to also just mention one aspect, that our people need to understand that whilst there are lots of issues around the lockdown, there are a few things that we've had to consider. First one is that the lockdown must not give us a problem of shortage of food supplies, and the President has spoken about that, and my colleagues will deal with that. Also, they also have to deal with the protection of income. My colleagues have to deal with that. Those are very critical issues which are important in the management of any health condition so far as we're concerned. So all of these issues that they'll be raising are about supporting the health of our nation. They are all about ensuring that we keep our people in reasonably good health whilst we prevent the spread of the infection. There is one caveat, though, which I want to mention here, and that is the fact that the lockdown helps us to reduce large numbers of people moving, wherein the infection flow would actually be unmanageable. However, it does not mean that lockdown on its own solves the problem. We still need precautions. We need precautions because in the experience of China, the 75% of the spread actually happened within family settings. In other words, if there is someone who's positive in a family setting, then the family tends to be affected. That goes for smaller groups of people, and that becomes an important issue to be still considerate about. So the hygiene of blocking your nose and mouth when you cough, watching a distance between someone who's coughing or sneezing is still very, very important. The issue of washing hands and hygiene is still very, very important. So people mustn't think, therefore, that, well, the president has declared a lockdown, we're now safe. No. This creates an environment, a condition under which we can all fight against the spread of the infection. So it's one aspect, but our aspect remains important, because between people to people, the spread will happen even if there's a lockdown. But once we stop large movement of people, we've reduced the risk significantly. Now the people must now reduce the risk between themselves. That is the point that I'd like to make as we move on. I'm mentioning these points just to put in context what, when we said this is a combat zone and every one of us is a force on the ground, we need to then know that we still have a role to play individually in stopping the spread of the infection. Yes, the terrain might be favoring us in this case, but we may lose the battle if we lose simple personal contributions to this issue. So I want to then say, I indicated that 554 new cases have been recorded overnight, and this is the results from as of 2300 last night. We have 5 confirmed conversions where people have turned negative who were positive in the original list. Most of our people are in a good condition. Many of them are no longer symptomatic, and some of them are still being looked after at home. We have record of 2 patients who are in the ICU in private hospitals, and then there is no death at this point. And I think it's important for us to be able to give you a sense of where things are. But the rate at which the numbers are increasing, we expect that the numbers will still increase. I hate to give you guessworks, but we still expect the numbers to increase for the next week. But once our whole program tightens up strongly, and we expect that probably if there should be a change, we should probably start seeing it not next week, but probably towards the end of the 2nd week or maybe the 3rd week. It's taken Korea 4 weeks to actually start seeing the inflection of the curve. So we must say that we will expect that in the next week or 2, these numbers, by the time we see the inflection, they would have probably gone 3 or 4 times or so. That's just a one man's guess. It's not even a projection. I'm just saying that the numbers, we mustn't be shocked when we see them increase. But these measures, if we all work together, must turn the curve around. But it won't happen tomorrow. It won't happen next week. If there's any change, it should probably take us a couple of weeks before we can see it turn around. So the theory and the thinking is that if we, for example, are able to contain everyone who has a potential of passing the infection, we contain them there. What an average 14 days lapses before you can actually finish off the viral shedding. So it should be possible to allow as many people to shed the virus without spreading to other people. That is the approach to this matter. And I want to explain that just so that we all understand what is the thinking behind it and what are the risks that we must watch out for as the people. Gauteng has got the highest numbers, now sitting at 302. We've actually geo-mapped them all. The large number of them are in Johannesburg. A few are in Ekurhuleni and it's in Tshwane and some of the other areas. Western Cape has gone to 113, increased by 14 yesterday. And KwaZulu-Natal, the third one, is at 80, which is an increase of 20. But that's where we first got the first patient, and there is where the first 4 patients have shown recovery and conversion to negative status. Free State is at 18, an increase of 5. This is the one I want us to concentrate on. Here we had a church that had about 300 people, and it was over 4 days. And in this case, the church had 5 people who were visitors from abroad, all of whom, well, it said about 7 who came from outside, but 5 of them were found to be positive, and they are actually still in the Free State. 1 has been taken to hospital, the others are still in quarantine. That's where we believe that the church got the infected from, and we have tracked now all those contacts, and we have found that amongst them, those are the ones that have tend to be positive. We have found them to be positive, as it were. I'll probably come back to that issue a little bit later. Northwest has now a total of 5 cases, and there's an increase of 1. Mpumalanga remains at 9, Limpopo at 4, and Northern Cape has got 2. With the one on Northern Cape, one has got a history of travel, but the other one actually comes from the church, to the extent that when we tested the person, they were still in the Free State. They had not even reached home, and so we are able to indicate that. Eastern Cape remains at 2. Those are travelers who came from outside the country who are still staying in that area. Then you will notice that there are some cases when we give you the statement who are unallocated per province. The problem with those is the numbers are increasing, and therefore we are starting to find missing information on the forms when we are trying to track where this person had come from. It means that once we release to you the information, it will say unallocated, but when we get the information, we'll clean it up later. It will be long after your press briefing has gone. As of 23 March 2020, South Africa had conducted 12,815 tests of COVID-19. 10,000 of these were done in the private laboratories, and 2,000 have been done by the public laboratories. South Africans would have noticed that as the number of confirmed cases increased, some cases were unallocated on age and gender. This is because now the NICD is not the only one that's got the responsibility of analyzing data from each laboratory. Each laboratory supplies information. Now NICD has to go back and try and decipher the details of this information. But it has also found itself searching for missing information, and therefore you've got a confirmed case, but the information is not complete. This has created an administrative burden, and if it's not rectified, it's going to hamper our efforts to be immediately in contact with the patients who have tested positive and to determine whether they require hospitalization or to be treated in self-quarantine, or even to trace all the individuals that have been in direct contact with them. This is the only way we can flatten the curve, by making sure that we use information as soon as possible. We must know every individual that has been exposed, and they must be immediately screened, and those who require testing must be tested without delay while they remain in self-quarantine. If those contacts test positive, we must further identify their contacts, because they also become the potential positive cases. You'll notice that I keep repeating this because I think it's very important for people to understand exactly how we're dealing with this thing. Simply put, this is a vicious cycle, and without quickly fully identifying confirmed cases and their contacts, the spread of the virus will keep rising. This is therefore the call for us to take stringent measures to ensure that we have all the information that is required. And therefore, at this stage, I want to make an announcement to all clinicians and to pathology laboratories. The National Health Act regulations relating to the surveillance and control of notifiable medical conditions, which were promulgated in 2017 December, impose a legal obligation on you to adhere to specific reporting standards. In this regard, I will refer them to Regulation 8, 9, 10, and 13. Therefore, it is compulsory